Okay, right, welcome everyone. Those of you who don't know me, I'm Lawrence Fowether. I'm a researcher and lecturer here at Liverpool John Moores University. I teach our sports science students all about physical activity. I try to anyway if they turn up to my lectures. Today then we're going to basically try and get a little bit step closer towards our evaluation framework for Altogether Active. And by evaluation framework, what I mean is we kind of decide upon the outcomes we want to measure in Altogether Active from a meta-evaluation umbrella perspective, a system level evaluation. And then after that, we can then choose what methods we're going to use to actually analyze those outcomes. Okay, so today is all around trying to develop a set of core outcomes, priority outcomes, if you like, that we're going to focus on for the Altogether Active evaluation. So in this room right now, it's really good and it's great to see what we've got, probably for one of the first times actually, is representation from all the different working groups in the same room together at one time. Is that the right? Is this the first time, Mike? Is this the first time everyone's together?
You were going to ask me. Yeah, I think so.
Yeah, okay. It's a good person to ask. So this is great, and the idea from this is that, you know, at the moment we've been probably working in a little bit of silos. Okay, so you've all got kind of chairs in your working groups, and they sit on the Altogether Active board. But this is a good opportunity for us to actually learn from what's going on in the different working groups and see what kind of activities and what outcomes are trying to be changed in those groups too at the same time. And today, really, what we're going to do is try and get you to work in the groups you're most aligned with first. And then in the afternoon, we're going to mix you up and you're going to work together, okay? It's a really busy day, really jam-packed, but it's quite interactive. Hopefully lots of discussion. I've got an idea in my mind about where we want to end up at the end of the day, but equally I'm open to this going in whatever direction it goes, okay? This is not particularly easy, it's complicated. I haven't got the answers. So hopefully us together are going to kind of go on a little journey really and get a little bit closer to where we need to be. All right. But there's going to be some difficult questions. It's going to be quite confusing at times, but we'll just have to try and work through and navigate through that complexity together. Okay. So the morning session, like I said before, working together in working groups. The afternoon session in mixed teams, where we'll develop our core outcome set at the kind of meta umbrella level for Altogether Active system evaluation. I know I'm not probably going to try and get you to kind of teach suck eggs here or anything like that, okay? But just so we're all on the same page, what do we mean by evaluation? So probably three key things. What's our theory of change? And so for us, we've got the logic models. They're helping us to try and make those connections between the outcomes, what we're trying to change, and also what we're trying to do to change those outcomes, all right? The activities that's going on in each working group that hopefully will facilitate those changes. We're also interested in the assessment of the processes, so what actually happens, the implementation, if you like, of the Altogether Active strategy, things that are going on the ground, what's being delivered, who's attending, what's the quality, the number of people involved, and so on. And obviously we're interested in the impact as well, okay? The impact's probably on an organisational level, but equally on a collective level as part of the system as well at the same time. But essentially, evaluation is all about learning, okay? And we're here to learn today. We're here to learn about how we're going to do our system level evaluation. But equally, when we mean evaluation, we're essentially what we want to learn through the projects, through the process. System evaluation methods kind of use the traditional methods around quantitative data, qualitative data, but also system kind of methodology as well at the same time. So quantitative data, things like our dashboards, we're going to hear about the Open Active dashboard soon and the Moving Communities dashboard. That'll be really useful. Traditional survey responses, the Active Live survey, for example, kind of official government statistics, but also any monitoring that goes on at an organisational or system level too. Then we've got kind of more the traditional qualitative stuff, interviews, focus groups, case studies, increasingly storytelling being used as a way of documenting what's going on, but also things like documentary analysis. So looking at things like the minutes of meeting notes from our working groups and seeing and reading about the significant changes that have gone on through those work plans. And then when it gets more complex is when we look at the system level, and you can use things like system theory, system mapping. You can look at social network analysis, where you try and map how are we connected with each other in this room on an individual level, on an organizational level. How connected is our system, but also what's the size of our system? How many organizations are involved? Because surely if we want to improve a connected way of working, one marker of that is that we are a more connected system, and there's more organizations and stakeholders involved in that as well at the same time, okay? We can also use kind of more system-based evaluation methods such as ripple effects mapping that help us to capture more broader impacts beyond kind of more traditional kind of quantitative data analysis, for example, as well at the same time. I'm not an expert in systems theory. I'm not an expert in systems thinking, all right? If there is anyone here that is, then great, okay? Because we really need your insight as we go through the process. So one of the first things we've done, and this relates to kind of the storytelling and how we capture information and learning through the strategy on a continuous basis, is we've added an agenda item to each working group meeting that's basically asking two questions. One is, have there been any kind of significant changes since we've last met? And also, have there been any significant challenges since we've last met as well at the same time? And by capturing that information, and it does take time in those meetings, we appreciate that, that's kind of helping us already start to capture some impact. And equally, it starts to kind of help us to see what barriers are ahead of us, in front of us as well at the same time. And hopefully what's meant to happen is that then gets fed upwards. And in a way, your working group chairs kind of filter that information up, and they just, they look at it and think, what's really valuable, what's really important information that I can share with the board level. And again, from the board level, that might go up even higher to kind of the ICB level and so on. All right, that's one thing we've always started to try and do, is try and capture impact as we go. Ripple effects mapping, some of you will have been aware of so far already. You might have already had a session on it, which is great. It's a really good interactive way that we can capture both intended consequences, but unintended consequences, but also we can start to see all the little steps that kind of occur for an impact to happen. All right, so this is the example from Active Gloucestershire, and you can see that kind of it works in terms of having some workshops every so often, normally every 6 months or so, and you capture information about what's been going on the ground and kind of look at the events which might have led to some impacts and so on, really. So this is quite a useful way of looking at broader impacts, as well as kind of those standard quantitative and qualitative measures. Obviously, there's existing data out there that we could look at too, right? So, there's a kind of public health outcomes data, some of it collected more frequently than others. We're going to hear from two kind of dashboard approaches as well, Open Active and Moving Communities. So there's existing data out there that might be relevant for us as well at the same time in terms of our outcomes that we're going to try and measure. Ultimately, we've got this global ambition, if you like, really, that we've got this aim of empowering 150,000 more people to move from being inactive to active by 2026. Is it the end of 2026?
2027.
Okay, all right, good. All right, it's nice to have that extra year. So the end of 2026, 27 broadly, okay? So we're talking about 3 years' time, all right? So that's where we're trying to go, okay? And obviously we're going to need to measure that particular outcome, all right? It's our key outcome. One of the things we've been talking to at the ATA board, and also hopefully you've been discussing some of these things in your working groups when you came up with the logic models, is also around system evaluation indicators. Okay, so how do we know we're improving as a system, okay? Altogether Active is all about a system-based approach. How are we assessing the quality of our system? And some of these kind of markers on the screen are ways in which you might want to do that, okay? And so when you go into your working groups, I want you to have a look at your logic models and just have a look at, have you got any system level indicators in there? Is there anything maybe on this particular slide that might be relevant for you in terms of knowing whether your working group is working better, is working more in a system-based approach going forward, okay? So you've got a copy of this slide on your tables, so please do refer to that just when you're reviewing your working group logic models as well at the same time. Okay, essentially what we're trying to do today is define the focus of the altogether active system level evaluation. Okay, we're setting the boundaries around the evaluation. So when you kind of go back to your working groups, what I want you to think about is, what do we actually want to learn? Okay, what do we need to learn from this particular working group, from these particular work plans? Okay, you've got outcomes, but what do you actually need to learn in terms of an outcome? Then think about, actually, why are we doing this? Why are we measuring it? Who's it for? Where's that information going to go? Okay, are you going to use it because you need to get investment? Are you going to use it because it's important for improving organisations and enhancing their work practices? What's the purpose of that information? What's it for? And who are you going to share it with? And that might also decide the method, because we might have different complexities of evaluation based on where it's going to go and so on. What's most important to you, your organisation, but also your populations that you're serving in your working groups? What evidence or existing data do we already have? Okay, are any indicators already being collected for that particular outcome? That doesn't mean that you rule out an outcome based on not having any existing data. Okay, you might have an outcome that you deem less important, but actually we've got lots of data on it. That's good to know, but it doesn't necessarily mean that you rule out a really important outcome because there's not really good data right now. Okay, but do use those things as part of your conversations. Also try and have a think about what counts as altogether active. Okay, what outcomes can you see on your logic models that are actually defined by our approach, fall under that umbrella? Okay, and then I was a good chat with Danny about this before. Okay, so can you see, if you've got outcomes in your logic models, that there are activities that link to those outcomes? Okay, hopefully there should be, but equally it's okay if they're not. Okay, so if you've got an ambition for an outcome in your working group, but you're not quite worked out yet the best way to implement to get to that outcome, the activities of choice, doesn't mean you have to remove that outcome, but just bear it in mind. Okay, might have a question mark in that black box about what we're actually going to do to change that outcome. All right, so these are the things I want you to try and think about as we go forward. So we're going to use a design thinking approach, which some people in this room, Lynn especially, probably will think, oh, not this again, but it's an approach I like to use, really. It's an approach that's quite good in terms of going from kind of divergent thinking, so, you know, people thinking differently in the room, but actually converging on one idea by the end of it, okay? And kind of getting you to work in kind of working groups, familiar groups at the start, before going into mixed groups, helps that kind of convergence approach, all right? Don't worry too much about this slide right now. It looks a bit confusing, but essentially this is the process we're going to go through to try and get to the endpoint today. And the goal of the endpoint today is to have a set of core outcomes for the altogether active evaluation, the system level evaluation. Okay. Ultimately, by working in the working groups and going together, you bring in your individual thoughts, perspectives, knowledge around existing data, knowledge around core outcomes, and so on, really. And then you're bringing it together in the afternoon session where we're going to work as teams to kind of get to the end goal. There's also going to be opportunities to review other groups, and you can learn from those groups, steal, borrow ideas. And again, that helps us to converge as we go forward. Given that this is kind of a bit of a co-development session, the usual kind of co-development rules apply. And I know we've got a very respectful room of people full of integrity. So we haven't got to worry about any of these things, but just be mindful about the importance of, if you're working in groups, listening to other people, being open-minded about responses, being attentive and in the room and engaged, giving everyone a voice, and ultimately it's about working together. And equally, if you don't understand or follow something, ask questions, probe it, okay? It's really important that at the end of the day, the logic models are clear. That helps us all to understand what we're trying to do here. Okay, so the morning session will be about the working groups, but before we go into that, what we're going to do is hear from two different examples, if you like. I guess really have used kind of big data, open data, if you like, really to try and put it into some dashboards. So the first one is going to be moving communities first, yeah? You got slides, Sarah, or not? Do you want to email me the slides, or do you?
I've got it all set up. Is it?
You can plug it in. I'm just thinking about whether I'll lose the Teams recording connection if you do that.
Sorry, you may need to do the other one then if you need me to email.
It's all right. Do it, Sarah. I'll talk through this part while you send me the slides. All right. Is that okay? Okay. So just while we're getting the slides ready for the first talk, first morning session then is about you trying to look at the logic models for each working group and look at the different outcomes in those logic models and try and decide and prioritize what are the kind of core outcomes that we should focus on from a system level evaluation perspective. All right. That doesn't mean that those outcomes aren't important still for your working group. They can still stay in the logic models. That's fine. They might become more peripheral outcomes, okay, but they're not going to be the core outcomes that the system level evaluation will focus on. And why is it useful to have a core outcomes list? It might be that those outcomes are the ones that we try and work together for each different place and ensure there's kind of a shared measurement approach for it, okay? We might work together, and that might be a goal of the evaluation, to try and align the method of measurement so that we've got shared outcomes across places as well at the same time. All right, so this is the first task that we're going to do. So eventually, once we've had the two presentations, we'll go into our working groups. You'll review the logic models that we've printed off on the tables, and you'll try and identify what you think are the core outcomes. All right, so the aim is to prioritize. And when you do that, you kind of use those questions that I went through before to try and frame your thinking, your perspective. All right, so it's going to be discussion based. You can review your logic models as well at the same time. So anything not clear, you've got a chance to edit, to modify, to clarify. You can make notes on this piece of paper. And then at the end of the session, one of us will come around with our laptops and we'll edit the logic models accordingly on our files, okay? So they can go back on the screen if we need them to go on the screen. All right. Where's Sarah gone? Have you managed to send it through? Cool. Right. It's in virtual space at some point. All right. Any questions just while I'm waiting for this email to come through? Any questions? No? Okay, good. All right. It's all right. It takes a bit of time sometimes, doesn't it, when it's in the microspace. Okay, after this session, just so you're all clear, what will happen is that basically we'll get one or two of you to present your working group logic model to the rest of the room, okay? So we'll get it up on the screen, we'll present it to the rest of the room, and that's really good because it'll be an opportunity for everyone in the room to see all the different working groups logic models, to look at all the different outcomes, to learn from the outcomes, and also to question and probe the choice of prioritization, okay? So there's a chance here where actually we can critically give feedback on actually has that working group chosen and selected the right outcomes to prioritize. All right, so we're going to do a quick round robin kind of event for it. All right, okay, hopefully it's come through now. It's still in space somewhere, isn't it? So still somewhere. All right, just while I'm waiting for this, what I'd like to do is just introduce yourself to the people on your table, just so people know who they are, if they don't know already. And then once the file comes through, we'll get started, all right? Is he not joined yet, is he? Oh, he's here. Hello, Tim. Can you hear me all right?
Yes, I can.
I can't hear you. 1 second. I'll change the sound settings. 1 2 1 2. Can you speak now, please, Tim?
Yeah. Hi. Can you hear me?
Okay. That's working perfect. All right, good.
Brilliant.
Okay, Tim, right, we're just doing quickly introductions on tables, and then we'll come to you for your talk, if that's all right. So, Danny's here. Well, I know you can see me or not. You can see me. Yeah, Danny's here with me as well. Okay, so
Yeah, good to
giving
see
you
you.
about 10 minutes. Is that all right?
Yeah, that's fine, no problem.
And then we'll throw in some questions after that, if that's okay. Okay.
Yeah, no problem. Yeah, absolutely.
Right,
We'll see how we go.
So if you could share your screen now, have you got slides, or are you just going to talk?
I do. Yeah, no, I've got some slides. Let me see if I can share my screen.
Is that as loud as it goes? Yeah.
Is that sharing okay? Can you see that?
Perfect. Yeah. Okay. Right. So while we're waiting for that email to land from cyberspace, we have got Tim Corby, who's kindly come to speak to us about Open Active. Okay. So Tim's going to speak for about 10 minutes, and then we've got time for about 5 minutes of questions after that. Okay. If you do have any questions for Tim. Tim, thanks very much. Over to you.
Brilliant. Thank you very much. So good morning, everyone. Thank you very much for inviting me here to speak with you this morning. And I'm sorry I couldn't be there in person to be with you all, but I really appreciate. I know you've got a really busy agenda today, so I really appreciate having a bit of time to talk to you about Open Active. I'd firstly like to quickly introduce myself. So my name's Tim Corby, and I work for an organisation called the Open Data Institute, or the ODI for short. And the ODI is a non-profit organisation which works with partners and clients and organisations all over the world to try and build more open and trustworthy data infrastructure. And by infrastructure, that could be people, that could be processes, that could be technology, all sorts of different things. And we have a small team within the ODI, of which I am part, which is funded by Sport England to steward the Open Active initiative, which is what I am here to talk to you about today. So without further ado, I'll crack on with the presentation. So we're all aware that there are all sorts of opportunities to be active out there in the world for people to take part in. These could be events, sessions, classes, like a yoga class at your leisure centre, or a training session at a local netball club, or anything like that. It could be facilities like tennis courts or five-a-side football pitches, which have bookable time slots, which people can book on and use those facilities to exercise. Or it could even be freely accessible green spaces, local walking, cycling routes, things like that, where people can exercise independently or with friends and family for free. These opportunities have data associated with them, all sorts of data. So it could be things like related to activities, like times, prices, descriptions of what the activity is, and what equipment you might need. It could be data about the location, where it is, what the facility is like, what facilities are there, whether there's changing rooms, all that sort of thing. Or it could be information and data about the instructors, the coaches, the organisation that is running the activity or that owns the facility. And there are lots of organisations out there that would love to be able to access this data. So there's people who are actually looking to be active and take part in these activities, which need to know all this information to be able to know where to go and whether the activity is appropriate for them. There's people in organisations like I imagine a lot of you in the room that are working to increase activity levels in your communities. There's organisations that are wanting to create strategic insights and better allocate resources and interventions and map provision and understand what's going on in different areas. And there's also innovators that want to build new apps or websites, other technologies that require that data to be able to kind of power them and to build them. And for a lot of providers, this data, unfortunately, currently sits in kind of what we call a silo or a bubble. It's difficult for the organisations wanting to use the data or needing to use the data to be able to find and access it. And even when they do, it's often unusable because, you know, the data and the information might be out of date, it might be inaccurate, or it might be in a kind of format like maybe a PDF document or something like that, which makes it really difficult to take the data from it and be able to reuse it. And so OpenActive is an initiative which is trying to lower these barriers and help organisations in the sector to share data more effectively. And the aim is that this will make it easier for people and organisations that need and want to use and access the data to be able to access it and create kind of new innovative uses and solutions with that data. And so how does OpenActive try and solve this problem? You know, how does it actually work? Well, OpenActive is often confused, and if anyone in the room has kind of heard of OpenActive, it's often thought that OpenActive is maybe like one big activity finder or a website which is taking all the data and trying to publish it. But this isn't actually what OpenActive is about. Rather, OpenActive aims to build the kind of core data infrastructure that is needed to allow all organisations in the sector to share data more effectively. And at the heart of this infrastructure is a set of what we call data standards. And these are kind of agreements on the technical format and structure of data about activity opportunities and how this is published and shared. But this is also agreements on sort of standardised language for describing activities and opportunities to be active. Just as an example, different providers might describe the activities they're running as suitable for kids or suitable for children, and one of those providers might mean under 12s, one might mean under 18s, one might mean under 10s, and so it's difficult then if you're an organisation who's trying to take the data from these different providers and combine it or create a new new uses and new solutions with it to work out what is each organisation actually means and to actually harmonise that. So OpenActive aims to sort of harmonise that information and standardise the way that people are describing opportunities. And so, as I say, OpenActive itself doesn't kind of centrally use or publish data or hold or manage data itself. Rather, organisations use the infrastructure and the standards which OpenActive has built to independently publish data feeds which conform to the OpenActive standards. And those data feeds are then accessible for any organisations to come and access and be able to reuse the data and create new innovative solutions and tools and platforms with it. And as well as the standards, OpenActive also includes a whole suite of kind of guides, tutorials, tools, e-learning, things like that, which help people to implement OpenActive and to understand how to share data more effectively. OpenActive is a community initiative. There's a whole range of organisations who have contributed and continue to contribute to its growth and development. And they're organisations from across the sports sector, so leisure operators, active partnerships, national governing bodies, but also other organisations sort of beyond the sports sector. So, startups and technical suppliers that supply technical solutions and booking systems and things like that, and also we've started to work with organisations a bit in other areas like health and things like that, which are also interested in OpenActive, and we have regular community meetings which are open for anyone to come along. People can showcase new projects and ideas, discuss challenges, and help to shape the development of OpenActive as an initiative. And lastly, over the OpenActive's been around for a few years now, and over that time we've also built up some evidence and learnings about kind of what works and what doesn't work maybe quite so well. And so what exactly gets published in an OpenActive data feed? Well, OpenActive is very much focused on the data which people need to know about activities in order to take part or to understand them, map provision, create strategic insights. So it doesn't include any kind of personal data about customers or members, and it also doesn't include any participation data about who's taking part in the activities. It's very much just that kind of basic information like times, dates, prices, locations, descriptions of an activity, all that kind of stuff that we feel should be more widely available because it's for the benefit of everyone in the whole sector. And so I just wanted to give you a few examples of organisations which are using data from open active feeds. So we have local authorities such as this example, which is Manchester City Council, which has built this platform with a range of partners called MCR Active. And it may well be something you're familiar with. And this aims to help their residents find opportunities in their local areas to be active. There are lots of active partnerships which are built, which are using online activity finders. This example in particular is London Sport, but that most active partnerships across the sector have some form of online activity finder which is using open active data. And finally, this example is a campaign called Everybody Moves, which is run by the British Paralympics Association. And this campaign aims to help disabled people and people with health conditions to find inclusive and accessible activities to be more active more easily. And all these examples are consuming and using data from open active feeds. So hopefully this gives you a sense for how when data is shared more openly and effectively, that the same data from the same activities can be used multiple times in multiple different ways by multiple different organisations. And so just finally, I'd like to leave you with some ways that you could get involved and support Open Active. Firstly, if you're a provider of activity opportunities, then please consider publishing your data more openly, and to the Open Active standards. That the more data that's out there, the better for everyone, better for the whole sector. Secondly, please feel free to start using the data that is already available through Open Active data feeds. There's roughly 500,000 activity opportunities being published per month through Open Active data feeds. So that's things like yoga classes and things like that. And there's also over 1 million facility slots being published per month. And so that's things like a tennis court or a 5-side football pitch, which is available to be booked. Spread the word. If you have partners and networks that provide activities, please encourage them to get involved and publish their data. As I said, the more data that is being published and being made available, the better for everyone, and the more innovation and solutions that can be built and created. And finally, please join our community. As I mentioned, it's a community made up of a whole range of organisations. It's open for anyone to join. So anyone here who would like to, you're very welcome to join up and help shape the initiative, make sure it's meeting your needs and the needs of the whole sector. So that's just a very quick whistle-stop tour. Thank you again for letting me speak with you. If anyone has any questions, then please do get in touch. I'm very happy to arrange a chat with anyone in order to talk about Open Active in a bit more detail, how you could get involved or answer any questions you may have. And also, if you're interested in kind of learning about data sharing more widely, the ODI has lots of learning courses, both instructor-led and self-paced, about things like strategic data skills, how to share data more ethically, lots of things like that. So, you might have some interest in that. And we also have some consultancy services as well. So, yeah, if you're interested, please do get in touch. So thank you very much. And I'll pass back to you over there in Liverpool.
Thanks, Tim. Good round of applause to Tim for his time. Thank you. See, has anyone got any questions for Tim? Dave?
Do you collect qualitative data as such, or is it all quantitative?
Can you hear that, Tim?
I did, yeah. So I don't know if by sort of quantitative data you kind of meaning sort of numbers of people participating in activities and things like that, but so Open Active is very much focused on just data about the activities. So what time it is, what location it is, what type of activity it is, any equipment that people might need to have to be able to take part, how much it costs, all that kind of stuff. So we don't actually have any data about, who's taking part in the activity or, numbers of people taking part or anything like that. It's very much just that data about the activity opportunities themselves, that kind of information that people might need to know about an activity in order to decide whether it's appropriate for them. Hopefully that answers the question. I'm sorry if I misunderstood what you were asking.
Thanks, Tim. Evan?
Hi, I'm Evan Williams, and I'm an academic GP. What about linking up with health data? You kind of hinted at it. What steps have you made towards doing that? And locally, there is, it's CIPHER, Combined Intelligent Population Health Action. And are there any links with OpenActive and CIPHER?
Did you hear that, Tim?
I think so. Yeah, I was struggling to hear a little bit, but I think I got enough of the gist. So in terms of linking up with health data, there's a kind of few places where things like that are happening. So we've got a few links with a similar data standard called Open Referral, which is being used by a lot of social prescribing systems. And London Sport have recently done some work on translating OpenActive data into the Open Referral standard, so that it can be pulled into social prescribing systems. And there's a few social prescribing kind of systems that are now consuming OpenActive data. In terms of the links with CIPHER, I'm not aware of any. I don't think there are any, but I'll be very happy to talk to you about that and whether there's any opportunities there or what opportunities there might be to link up.
Stefan?
Yeah. We make representation constantly to the CIPHER leads about broadening and standardising data collection for physical activity. So it's a work stream that we're actively working on with CIPHER. Okay. I'd say we haven't made a great deal of traction in that area at the moment, but it's something that we're trying to do. I think they're waiting, if I'm being honest, for some standardised data collection metrics to be applied across Cheshire and Merseyside, which I'd say is at a systems level we don't yet have. People collect data about physical activity in lots of different ways, and I think until we're able to provide universal standardised data, we may be pushing it slightly in closed door.
Sorry, we've got to move on, unfortunately. I'm very sorry. Tim, thanks very much for your time. Appreciate you joining us. All right, we've got to move on, but thank you very much. That's been really useful. Thanks a lot.
No problem. Thank you very much. And yeah, I'll just leave you with saying again, if anyone wants to chat more, then please do get in touch with me. Very happy to talk to anyone. So thank you very much and enjoy the rest of your day.
Thanks, Tim. All right, I know this email's come through now, so we should got it twice, so I'll whack it on. All right, so we're going to hear now about moving communities. I will just get rid of that. Where do you want to stand, Sarah? It's up to you, wherever you want.
Gosh, this is very, I'm not used to this kind of setup here. It's really good. Let me just flick through, start off. First, right, for those of you that don't know me, I know there's a few faces in here I haven't seen before. My name's Sarah, I'm the Active Wirral Manager, and my role is to look at predominantly that big transition for us from leisure in most local authorities having a really transactional relationship with all its customers and providing activity to really providing the value and tackling the inequalities that are happening across our borough. So for those that don't know Wirral, we've got a motorway that runs right down the middle of it. So we have real areas of affluence and then we have real pockets of deprivation on the other side. So we've really started on this journey. I think we've been going sort of like 4 years now on it. We've worked really closely with Sport England, and this is sort of how the Moving Communities platform came along. So when we went into COVID, Sport England gave funding out to operators in order to ensure that leisure facilities remained open. So Moving Communities to begin with was a tool in order to track leisure facilities recovery from COVID. So there was a few of us that were a strategic partner with Sport England at the time, looking for capital investment to change our leisure facilities into real community hubs. So there was a few other local authorities that were brought along in this journey. So what that gave us was an online data platform that was able to show us the value of our leisure facilities that was above and beyond the finance, and it was able to track our recovery from COVID. So what happens for us in Wirral, as a local authority, we run a subsidy. So the council put in money at the height of that subsidy for every person that walked through the door. If you wanted to go for a swim, whether you paid a membership or pay and play, the local authority were paying just over £5 for that person on top of what they're paying in order to have that. I know we call subsidy, but it's a real investment into people's health and well-being. So it's how you do it. So we went on that journey, and what it really helped me is Wirral, the financial position of Wirral as a council as well. Like most local authorities, it's sort of on the brink. So what this did was be able to give me a bit more value that was above and beyond the financial point of it. So we had social value, we were able to track how many people were coming in, we were able to understand where people weren't coming back from COVID and where we are. We as local authority had a very slow public health, for all the right reasons, delayed our recovery. So where most local authorities were opening up their services, we were still closed, and that had a huge impact on what we were doing. So we've been using it. We know our leisure centres provide £12.5 million worth of social value every year. But what we were finding is we've got these social value metrics, but what does that mean? What does that mean to really integrating what you're doing into the system? Because you could go to the Community Foundation, they say that's great that you've got this much contribution towards subjective health and well-being, but is that going to reduce the number of GP visits, or is it really going to tackle the barriers to why people are being active? So for us, it's very different. People tell us around the barriers to an activity, I don't know what's going on, I don't have time, but then once you really get under the skin of why they're doing it, those barriers to those people for us on Wirral are very, very different. So along came the next phase of what Sport England were doing with Moving Communities, which is Moving Communities Place. So one of the things for us on Wirral is we're quite unique in that people used to call us the Leisure Peninsula, and we've got golf courses everywhere. You've never seen so many tennis clubs on the Wirral. We've got one football club that's got 98 football teams in it. That's just one club. So that could hold its own 2 full 3G football pitches and could run them themselves. Yeah, we've got real issues with inequality. So there's a big gap there between all the activity that's on offer. So people that have the means to do things are very active, but we still have those real issues with the 30% of people on Wirral are inactive. So what Moving Community Place does, it looks at some strategic objectives that you have as a place and how you can use data in a better way to look at starting conversations and starting ways in order to be able to tackle the inequalities that are there. This is the presentation that 4Global, who pulled together the Moving Communities platform, was pulled together, and I thought it was the best. It's way better than what I could have produced. I'll just drop down onto the next slide. So what it does, it gives us like a dashboard, and I'll come onto that and I'll just show you because it's quite nice to see it. In any place, we've got loads of activities going on. So for me in Wirral, I know all this activity is going on, but I don't really know where it is. So we know it's across. We've got ourselves as a local authority. We've got our area. There's loads of community programs going on. We've got private operators in, Total Fitness and the Village. We've got health programs that are taking that we've only got a few in Wirral, but that are commissioned. So we don't have things like an exercise referral program, and we've got loads of NGB. Activity, and also things like Park Run that are taking place. But what we don't know is where are we as a to benchmark all those. And what it does is Moving Communities Place. The ambition is to bring that all together for each place in a dashboard. So for us, when Sport England approached us, I think there's Davis. There are about 8 of us that are in the pilot.
There's about 7, yeah.
Oh, is there 7? Yeah, Dave's going to just talk about the practical sides of how you do this. So For Wirral, we have 3 strategic objectives we wanted to use Moving Communities platform. So first thing was to create a baseline of all the activity that's going on. Like, that ambition is huge, to get every single person, whether it's informal or not, to come together. But what it can do is start that journey around us understanding what's going on. The other thing, which is slightly left field, but just for us, we needed to very quickly look at what's happening in our leisure centres and actually how do we realign that to now what does need to happen. Most of our leisure centres, I think, were built in the 70s. We had one that's built in 1905, I think. So we've got a really aged stock of facilities that were developed, if you can, in the 70s. Like, squash was king, so we've got like so many squash courts. Yeah, that's not what people want. They want a really nice environment to come and sit down. They'd like some health services in there that they can have a chat with. They want the library right next to them, but squash is king currently. So we really needed to understand that and overlay it with what's going on in the local community. And then the final thing for us was understand the residents' views and perceptions of physical activity. So we've done this a few times now, and we're on a bit of a journey as well from that engagement spectrum, going from your consultation through to pure co-production. And we've been on that journey, and this is really great for us to understand. In a snapshot, I think we've just got about 470 people so far that's come.
To pick up on that bit, Sarah?
Yeah, I'll come in after Dave, and then you can talk. So it's been, for those kind of 3 objectives, that's what we've asked for Global to look at for this platform. The thing that we found, and I know Dave will talk about it, is anybody that's within my power. So if you block book a leisure centre, if you are running one of the programmes, it's in my gift. I can say you have to complete the data on here. But Dave will just talk about how do you make a movement of people that all want the same ambition in view, and how do you get them to be part of this and upload onto a platform, and what are the benefits there. Dave will just talk about that in a second. I just wanted to flip on to just sort of show you really what Moving Communities Place is. So for us, we've got amazing intelligence service with all the JSNA data. What it can do, it gives us our area profile of all the different layers around health inequalities. And then what we can do, and Dave will just sort of talk through in more detail, is overlay all the activity providers that are taking place so we can understand what activity is happening in each area. The tool is really exciting because on the other side it can track, demographic data, things like that. When we're looking to what we can do with this data, it will predict where we need to put physical activity as a preventative tool to look at that. So for us on the Wirral, we've got pockets of whether it's coronary heart disease or whether it's cancer. What we can do is where we know physical activity can support that and we've not got anything in that area, then it will highlight that to us, so we're able to go out and do that, as well as giving us the overall picture of everything that's on there. The other thing that it does, it pulls through the social value of everything. So it gives us health indicators. I think one of the real things that this showed me going down the Moving Communities journey is the more active we get people, you can sort of see on the graph on the right, you can sort of see here for injuries. So it's really interesting that if we're going to do this really well, what we need to do is really look at our MSK pathway and make sure that that's actually a really significant part in what we do to ensure that people, if they all start engaging in activity, we know that we can keep them health and safe, more healthy along the journey. The other thing, it does give you the social value on each of the different areas. So every individual provider will have a dashboard like this that they log into. I will just leave the dashboard up and I'll just invite Dave to just come and
go back to the previous 2 slides. No, going forward.
That one. Yeah. Do you want to do?
Yeah. Not used to public speaking. This is nice, isn't it?
Yeah, maximum 5 minutes on the screen.
Okay. As you can see on the slide, Sarah explained about the sort of the mosaic, and we can have different sort of layers on there as well. So I think it doesn't really show on here, but I think we've got 600 providers on there at the moment. We're working closely really with 4Global to try and get some sub-layers really. At the moment, it's just lots of different sort of dots on there to say where the providers are from. So it could be a mixture of sort of leisure centres, it could be sort of private organisations and also local sports clubs on there. So I think we're sort of cutting edge on the Wirral with this sort of pilot scheme to try and get these different levels, so we can get sports clubs, we can get sort of NGBs, third sector organisations, we could have NHS providers, etc., to have the different layers on there so you can plot and actually see. The second part of this is the main important bit as part of this is to try and get the data collection of these providers, because most of the data on there at the moment, which is plotted, is more through the active places, the Sport England active places. But really, we want to drill down into the sort of granular data. We want to go in ward by ward and actually see what's going on in those particular wards, in those particular areas. So when it comes to planning and looking at new activities in the area, we can find, for example, if you cross the road on one street, they're doing aerobics, and someone else across the other street could be providing aerobics. So it's about joint working really. What else can I say? Yeah, so the data hub really, there's two ways they collect the data. How long have I got, Lawrence? 2 minutes, sorry. Once you get to talking, you can't stop. Once you, there's two ways we collect the data for clubs and organisations. Really, one of the parts is through like an API. So some of the big national government bodies are providing that data already. And secondly, we're working closely at Sport England or with the NHS to see whether they can get some of their sort of data in there as well. The other way is for smaller sort of clubs and organisations is through a paper copy version, but it's not ideal. So we're looking at ways we can get that through. Sarah and I have been having discussions with Sport England. This is great for sort of sports clubs and organisations providing their data into this database, but we want to come up with some sort of system where we can monitor individuals through like an app. So it'd be on their phone so they can monitor, and this sort of data would go onto this platform as well. So that's something we're looking at as well, maybe. Just recently, live at the moment is the community survey. As Sarah mentioned before, we've got around about 600 residents who filled in this survey. Again, really, that's basically to look at sort of what are the barriers for people on the Wirral. So, to look at to get them into participation. So, sorry, I've lost my trail of thought there for a second. Is there any questions from anyone? Okay.
Yeah, that was really interesting. Just in terms of like how you survey the residents, how did you target them? Are they the least active residents of the Wirral? Are they in the most deprived area? Because it's about trying to get that 30% more active, isn't it?
It is, yeah.
Just a general kind of survey across residents that might already be members.
Yeah, we use some of the Together funding to expand we have community connectors on the Wirral, that are door knockers that go around as public health things. So we've used some of the Together funding to get 2 days a week, so we've got a dedicated sort of physical activity connector. So she's going out and she's knocking on doors. The survey is very long, it's a standardised survey as well. It is very long, and it's one that all communities do it. But what we've done, we've gone through our networks of everybody that is within the voluntary sector, those that aren't active, as well as those that are active as well. So it's a start, but with what we've got, it's as close as we can get to those. All the messaging that we've done is around, like, pass this on to the person that you know that isn't active, rather than kind of fill this out. So that's as far as we've.
Is there any learning you've got there? Any learning
from the results, or from the
survey, from the people that are not active?
from the.
We haven't had the results through yet. It's still live. It closes next week.
I think all of us in the know something like they're all saying that what we find is people know that it's important to be active. They know how to be important to be active. They know it's interesting or take sort of on the activity finder. They can find the stuff. It's a bit clunky. They can go online. But what they're telling us is there's other reasons that they're not doing it. Whether it's judgment, they feel like they can't put themselves first. They can't see themselves. So for us, it's the kind of feedback that's coming back is they need someone to hold their hand, and this is sort of what a lot of work that we're doing because we don't have that offer to support. You know, come for a walk or
motivation as well.
Motivation,
Self-motivation.
Yeah.
Quick question, Matthew.
Kind of following on from that, and it's difficult to do, I know, but kind of going back to what James just said about trying to capture, I suppose, data on those who find it least accessible. What are you doing in terms of trying to capture informal physical activity? I'm thinking about really, walking in particular. So it's not really stuff to do with formal clubs or the like, but it might be around active travel, walking to work, or it might be just around simply recreational walking, the like. It's difficult to capture outside of the club structure, but that's a massive part of this piece of work. I would imagine, in particular those who don't have the means to actually access more formal forms of sports and physical activity, owing to lacking.
That is something we want to look at, to be honest. And we had a meeting yesterday with For Global, and that is they're talking at a national level at that to see how they capture that information. Because I was on a call yesterday, and our sort of public sort of transports from the council were quite interested in active travel in capturing that information on this sort of data hub as well. So it's something we will be looking at capturing.
Yeah, and in all honesty, we know that it's there, the informality around it. We've had conversations just around, the trackers that are links and how just how do we do it. But at the moment, we just don't have the resource in order to grasp it. We've had this conversation, and I have had this over and over, that we just at the moment, in all honesty, we're actually missing everyone. Yeah.
Okay, thanks very much, Sarah, Dave. Good to learn more about moving communities. I think there's probably some parallels between open active and moving communities to an extent in terms of a bit about opportunity, but probably there's a few added layers in moving communities from a participant capture perspective too, and that kind of linking data sets a little bit as well, right? But then, yeah, I'm probably totally wrong, but hopefully I'm a little bit right. Go on, Mike.
I know we're running behind, I'm really sorry, but I think it's worth just mentioning. Just yesterday, and I can have that verified, literally yesterday, we got an email, so Active Partnership CEO's got an email yesterday from Sport England about moving communities place, about having access to active partnership-wide data. So we know that we can get it at an active partnership level. There'll be a couple of questions that I'm going to go back to Sport England with, while saying, can I now have it at a sub-regional level? Forgive me, MSP colleagues, I haven't spoken to colleagues yet, but actually we want to share that data right across so that we've got 9 local authorities built into one dashboard, so that we've got a place that I find quite exciting. But then my second question is going to be, well, how do we include other data? But we've got to understand that this system was built as a response, and Sarah said it, to COVID recovery funding, so it wasn't designed to capture everything. And we've just got to bear that in mind when we ask these questions back off. It was designed to capture leisure centre data. What we want it to do is, we want Sport England to understand that leisure doesn't just happen in a leisure centre, it happens in lots of different settings. So how can For Global develop their systems over time to capture different types of leisure activity data?
I think it's a work in progress, it's just evolving.
Yeah, I think just for us, we're obviously we're a pilot, so it'd be really interesting. I think now the evaluation group have had it just sort of feed in and see if it's something that the group, like it's just to say that's kind of the steer, isn't it? So it's sort of like for the evaluation group to see if it does play a part, or if there's something else that we're going to look at as.
Yeah, and I think this, and this is where lots of different methods and data sources will feed into it, right? And this could be one of those data sources. I think this goes back to what I was saying before about, you know, reflecting on what you just said, Mike, about where we've not got existing data, then this is a chance for us to be aware of that and maybe lobby for those kind of things to be included, right? So it's an important part of the conversation that you're about to have as we go into the next task, all right? A little bit behind on this, so we're probably going to change the times a little bit. I'll give you from 11:15 till 11:45. Because I'm so used to teaching students, I never ever do this in terms of telling people where the toilets are or what happened if we've got a fire alarm. No fire alarms planned today. Toilets just around door here, turn left, or just on this corridor. If you do have a water bottle, there is a water fountain down by the lifts. Follow down the corridor straight on. It's on the left there. Yeah, that's probably all the key notices I need to give you that I should have given you at the start. This task then, so what I'm going to ask you to do, so if I just get people to shout out from each table what logic model's on the table, then what I want you to go and do is go and work on the table that you feel most aligned with in terms of it might be your working group, or if you sit across lots of working groups, go to the one you feel most aligned with, or go to the one with the least people on because it looks a bit sparse and we need a bit more people in that area. If you're part of the board and you don't sit on a working group, then just kind of go to the one maybe where we kind of need a few more numbers for people to work around. But your task is to review the logic models, check again the outcomes. Do they make sense? Are they clear? Have you considered system level outcomes in the working group as well? And then once you've done that, it's to prioritize, just to decide on your core outcomes for your working group, okay? Using the hint questions that are on the screen here. All right, you've got half an hour to do this, not a long time. By the end of it, we will come around with our laptops and we will basically edit the logic models based on your edits, and we will bold or highlight the core outcomes that you want to prioritize. And then the next step, you want to come, one or two people from your group and present your decisions around your prioritized outcomes and just quickly relaying the activities in your logic model to the rest of the room for a chance for some quick feedback and comments, all right? Does that make sense? So, Mike, what's your table?
Active travel.
Sonia, what's on your table?
Live well and workplace.
Okay, active travel, live well and workplace. That table is? Age well, this table is? Place, that table is? Start well, and this table is? Workforce, okay. So, stand up, move yourself around, go to the group you're most aligned with, and then kind of crack on if you can.
I know what to talk about. Is that all right? Sorry, I know.
We're good, we're a bit tight for time now, but we'll see how we go. Yeah. So we really just need to work.
Big words.
So we can move forward.
Yeah, sure.
Ian, if you look across two groups, then, yeah? You go across two groups. You're right here now. It's kind of nice to shove across the group. Is this your little group, is it? Over there. Give them about, give them some different colours. There is flip chart paper. I'll bring some post-it notes as well. You can use whatever you want to use it, right?
Yeah, I think it's a input activity. Probably working towards the right hand side.
Yeah. In your logic models, good point. In your logic models, when you review them, sorry guys, 1 second. In your logic models, when you review them, just focus on the outcomes and activities, all right? Don't review everything, there's too much. Just focus on the outcomes and activities for now, all right? Prioritize outcomes after that. There's some post notes if you want. We've got this one thing to work out for the ones that are solid black, maybe just have
The one that laughed.
solid black, like you know the actual body of the pen, that's okay. Where it's a black.
Okay, so the main thing, so first off, also the last most
So the last meeting starts.
So again, for example, this short term how we measure it, what this logic is not I'll probably say first of all, short, medium, long term objectives, work out what
When we looked at this decided what there was lots of appropriate for this area as well. We knew these are policy issues. The ultra-rapid call instead are the sporting conditions just the most appropriate system to change from Cheshire side. And we said probably the only activity one at the moment that so why wouldn't we kind of support them? But what we also do is saying that they may be the right one.
between activity that happens on ground and so there's definite, there is a line between and all of that will be able to extract it. And then people use the condition probably not at the moment, but we're probably going to work towards it. And then going after. When we look at you're not responsible for a portion of that. The physical activity system is responsible for it. So that's all of the clients, all of the responsible for it all. So it could be that midwives are going to take pregnancy, more active during their pregnancy. So there's a portion of that that's going to be in the nurses. So but how do we capture the data back in and where people are, where they are? And they need more. I like the idea of activity trackers, but not actually business customer, business person who can get something or how can a midwife provide the activity?
Ian, I'm going to keep this going until 12 now, right? So keep this part going until 12. Andy?
That's how it starts. Double take. However, you need to find some commonality between all those 9 houses. So at the moment, I call them all together active. They may look completely that class. The bit that I agree with is, where can you find the commonality in all of those classes? So if we take the starting point of the age for implementation, and are they taxing the small medium and long therefore then identify metrics for how you collect data around physical activity and how it's paying that's where I don't know what every place plan looks like. Have something that they can bring everything together and record it up, things that can find some commonalities in that plan. Helping or complicated, I'm not sure. So, for example, we would be able to report back where isn't within places, but it's not international. How the diet driving the economy all the time. Physical activity doesn't have a metric around it in your local authority. What can we do to change that? What helps do you need as a local authority and therefore how you can actually 12,000 surveys out to your residents. How can we extract data survey results, when the common outreach starts to activities, place level start changing.
Because it's a long term, it starts now, work starts now. So that's obviously. So you're right, it's not like we're going to engage with people, we're going to engage by the time long term. That'd be amazing, wouldn't it? It wouldn't be a priority how do we get into that mindset from your experience? Get that down. That's the system. Get that down, Molly.
Right.
Yeah, I'm just going to do that Sarah's laptop.
Oh yeah, okay.
So, don't want it to get crushed by the catering.
That makes it. You're on the table.
Open the door. Have more conversations. Try not to look at your train.
No, I
allow that. Do we see that still as a priority? To put in the evaluation framework. So really, it would be opportunity highest priority. Where the money commission that
Okay, just to say, guys, when you're prioritising, there's not a minimum number or a maximum number I'm going to give you. It's just up to your working group to justify what you selected. Okay, so up to you.
If we have that priority, next year when we get it, I can maybe 50% collecting data around that's allowed to thousands of checkers more rapid. That's where I'm trying to think.
Right, you got your last 15 minutes to prioritise now. Last 15 minutes to prioritise.
Nothing happens locally without that.
Just a reminder, don't forget the hints. The hints on the white screen. Everyone put your heads up. Look at the hints. All right, when you're prioritising, don't forget the hints.
I don't know what you're saying. got the answers to the questions, like, we're trying to build a platform to get to the answers.
It's no-brainer, isn't it? So this has been from pilot, so then on pilot. We'll contact it. Yeah, the learning of pilot goes back to the content. So apparently, yeah, that's
Or vice versa, that you can handle how do you manage to get that from, because I was
main action isn't going to be these colours are not opportunities. So you can imagine each one of us looking at the eye and going, yes, I want to get free from this. I want to look know what my asset's going to be, what that's going to be. There's no point in me going there and saying, here's what we're doing. It helps you lot to kind of be our place. What the other prices sign up on that's going to be.
Yeah. Probably a bigger job at for me, to allow this global world of all the actors to happen events. That's what we want to do. If you put them on, do it, try to do it individually, then I'll always find it. I'd love to know that you're not on behalf of your place, just do it on behalf of your which one do you think is most important? John,
Just because it's fast, that's less important. So it might happen
Yeah, back. Just my module to go through, right? Right. Have we prioritised outcomes? Active travel. Prioritise outcomes. You nearly there? Do you need 5 minutes? 5 minutes. This table, have you got there?
we're done.
Good. Age well? Nearly there. 5 more minutes for you guys. Start well. Okay, 5 more minutes. Going to finish at 5 past, so make sure 5 past, 5 minutes, all right? 5 past. 5 minutes, we'll finish and get lunch, okay? And then someone will need to tell Danny, Ian, Jack about the edits. Jack, can you work on the place?
Very good.
Like 200,000 people. Wouldn't it be great? Not I'm sorry, not that might be our sixth priority idea, but without these five steps involved, to go through the solution data approach and constantly buying and strategy in each place, absolutely needs out of what we can do. All moral approach to that. How all of those 9 years what they have to see is a way of winning votes at the next election. So if we give them an opportunity to really demonstrate that they can help them the community which they represent, they're going to buy it. Because we're going to say to them, be our champion, and I'll give you more consistent data. You'll have more commission back out. You'll have a, story that we can tell you. You'll have a time that's what you want. This is all back to politicians when they vote. They don't want to do anything. That's exactly the approach that we're going to take. Help us to be more interested. Help us to be more commercial. We need to be yeah, and then we're back to look at going to start and find
Finished, yeah? Finished?
Well, we gotta go in.
Right, okay. Hopefully you've all finished. We need to come round and make sure we capture your final logic models. Go and get food. We'll reconvene at 1:45. Okay, so 1:45. It's past 35 minutes for those people who are wondering what time it is. There's vegan options on the far left, vegetarian sandwich in the middle, meat sandwich on the right.
In your practice around what they I want to know what you think about the and I'm better with right control process. It's actually nothing and you don't do that one. So I think it might sit as a sub-part, it might be price responsibility, it might not be in his logic of it, but actually it may be in the framework of clarity around and it might be going back to the point I made earlier. Actually, that isn't something that is fine, but actually it's something that's the question of how it's the implementation of trying to get more people into the activity. Two pieces of activity priority at the moment, one around active travel and the one that but actually by getting more people active in a fair way by tightening blood by community, by removing barriers, by doing all of this and all of that, we're helping towards the global aspiration of being more fair and society. So it might not be top down, it might be what's there, it might be a data collection, one question, but you get 9 pages of information on how places do. Again, that's life we haven't got visual to. We want to present a 3-year business plan. It's option 1. Option 1 will deliver your then priorities. Option 2, you've got to strike the bottom 3 off there because that's what we do. Option 3.
Within our existing resources. It's the third highest interface. Where does it fall in there? Or a very small amount. Yes, so how do we have that conversation? Where
to allow them to confidently talk about the role of progression and play for spectrum models. We need to have great places, reliable data, that they're saying the right things, or otherwise you get into those age-old basic midwives have. So, for my first year, I got told not to do it. The second one, I got told it was a great idea to give them a dummy. What can we tell professionals to talk about what we have, what to rely on rather than having professional. We've got those lovely chaps.
Is that all right?
Oh yeah. How was yesterday?
Robert, are you free for 2 minutes? Yeah, can I borrow you? Thank you. Get your notepad, James. Yeah. I've just been telling you about I think it'd be really good. Well, I agree that it's it gives a slide. That's why we've got we put it in our team's hands to see whether they wanted to go digital. Some just might be a session. I was too rather than next fashion Tuesday.
Is there any lodge models as well, or just the list of outcomes?
Workforce have done it, type it up. It's not logged in.
Oh yeah, you chose that. It's not the same module. You're right. Yeah, sorry, you told me that already.
I've just
sorry, in
sent
my
you
head.
the imagine the outcomes now.
Yeah, I've got that. Thanks, mate. In my head, I'm just trying to work out about whether to go through the full logic models now or just go through the outcomes.
I just go through the outcomes.